I think there's a perception that it does. If you can bear with me. So Queensland has been subjected to massive privacy information around health records. So we've had a particular criminal element who's been, crypto-locking GP practice data information, and then what they're actually doing is copying that data over the course of a weekend while they're trying to blackmail the GP practice. And what they're actually doing is they're going through those records to gain every piece of information they can about their clients to see what they can do to blackmail those. And then if the GP practice does pay up, they'll get a little key and they'll uncrypt their doctors and they'll keep going, and probably don't notify their patients of that breach. In the meantime, that same criminal element is now selling that information around those patients of that GP practice. And so we've all heard it before. Most of you have attended security conferences. It is true. A health record is worth $250 versus a credit card record of $2. Health records contain a lot of information that has a lot of personal information about patients that can be used by many different sectors. At the end of the day, we all know Security 101. You have to make sure that you're engaging in the privacy and the security of the data that we're custodians for. I don't own the data of my patients, I am the custodian. And just like if you give me your wallet, I'm going to try and keep it as safe as possible.
Thanks. John?
Look, it's important to health, but I don't think it's any more important, security is any more important to health than it is in other sectors, be it government or education and financial services. It's interesting, there's been a number of surveys done of consumers to ask them this very question, and the typical response that comes back is that consumers and patients are a lot less concerned about the security of their information than healthcare providers or IT vendors, security companies and so forth believe them to be. So I think it's overstated, and there are a number of reasons for that. I think the healthcare sector can learn a lot from what our associates in the financial services sector have done, and they've done a lot to, I guess, create that confidence and reassure their customers that their information is secure, and that's probably, I think healthcare could probably take the lead from financial services sector in relation to that. But one should be concerned about records. They are highly valued on the black market, as NASA says, but that's no reason to hold back the adoption of digitisation and really advancing digital health in Australia.
So for us, it has to be the Internet of Things. So MeCare in particular has shown what data from those devices can provide clinicians around the health trajectory of patients. And that's not only that, we've known about Internet of Things in hospitals for a long time. We've had lots of machines in our hospitals and lots of robotics. And data behind that has been huge in terms of research and making clinical breakthroughs in the way we treat patients. So I think for us, there's probably two challenges. The first is the Internet of Things and how we can capture what's happening with patients out in the community to actually help them stay healthy and avoid coming into hospital. The second is how we present that data to them. How do we get that information to them in a timely fashion, and how do I get that to my clinicians at the point of care to make that intervention?
Yeah, it's an interesting question. Look, to generalise, the health sector is the lagging sector in terms of digitisation. Probably got financial services that are at the other end of the spectrum, really in the avant-garde. So I think I'd nominate the humble smartphone, and not because of its mobility, but because when you think about the changes that have happened as a result of smartphones in user interface design, it's really been quite revolutionary. So I think the introduction of phones has created a major rethink of how we as users, that human system interface works, and that's a very important point to reach in healthcare, because it's very, very difficult. It's a very complicated work environment to do that digital capture, to translate from non-digital into digital, and having a good, modern, easy-to-use user interface is probably key to keep advancing that digitisation in the healthcare sector.